Hi viewers, welcome to my YouTube channel. Today we will discuss about the symptoms, causes and treatments of tuberculosis. Tuberculosis is a contagious infection that usually attacks your lungs. It can also spread to other parts of your body like your brain and spine. A type of bacteria called Mycobacterium tuberculosis causes it. In the 20th century, tuberculosis was a leading disease of death in the United States. Today, most cases are cured with antibiotics, but it takes a long time. You have to take medications for at least 6 to 9 months. A tuberculosis infection doesn't always mean you will get sick. There are two forms of the disease. Number 1, latent tuberculosis. You have the germs in your body, but your immune system keeps them from spreading. You don't have any symptoms and you are not contagious. But the infection is still alive and can one day become active. If you are at high risk for reactivation, for instance, if you have HIV, you had an infection in the past 2 years, your chest X-ray is unusual or your immune system is weakened. Your doctor will give your medications to prevent active tuberculosis. Number 2, active tuberculosis. The germs multiply and make you sick. You can spread the disease to others. 90% of active cases in adults come from a latent tuberculosis infection. A latent or active tuberculosis infection can also be drug resistance, meaning certain medications don't work against the bacteria. Latent tuberculosis doesn't have symptoms. A skin or blood test can tell if you have it. Signs of tuberculosis disease include a cough that lasts more than 3 weeks, chest pain, coughing up blood, feeling tired all the time, night sweats, chills, fever, loss of appetite, weight loss. If you have any of these symptoms, see your doctor to get tested. Get medical help right away if you have the chest pain. Tuberculosis is caused by bacteria that spread through the air just like a cold or the flu. You can get TB only if you come into contact with people who have it. Tuberculosis risk factors. You could be more likely to get tuberculosis if a friend, co-worker or family member has active tuberculosis. You live in or have traveled to an area where tuberculosis is common like Russia, Africa, Eastern Europe, Asia, Latin America and Caribbean. You are a part of a group in which tuberculosis is more likely to spread, or you work or live with someone who is. This includes homeless people, people who have HIV, people in jail or prison, and people who inject drugs into their veins. You work or live in a hospital or nursing home. You are a healthcare worker for patients at high risk of tuberculosis. You are a smoker. A healthy immune system fights the tuberculosis bacteria, but you might not be able to fend off active tuberculosis diseases if you have HIV or AIDS, diabetes, severe kidney disease, head and neck cancers, cancer treatments such as chemotherapy, low body weight and poor nutrition, medications for organ transplants, certain drugs to treat rheumatoid arthritis, Crohn's disease and psoriasis. Babies and young children also have higher chances of getting it because their immune system are not fully formed. So all these are the symptoms, causes and treatments of tuberculosis. I hope you like my video. Please subscribe my channel. Thank you.